my name is Dan Stoyanov, and I'm a professor in the Department of Computer Science. I'm a professor of robot vision. So most of my research is around robotics, and in particular, developing AI systems that can enable surgical robots to see. So myself and my research team work a lot on surgical video from different procedures, and we try to develop capabilities that are similar to what a surgeon can do with the surgical video. So detect what anatomies are there, understand critical structures, make decisions, understand how the instruments should move, know what instruments are there. So really kind of develop the foundational understanding from the video and the images that we get in surgery. It was a little bit random. So after my undergraduate engineering studies, during my bachelor's thesis, I worked on a project doing computer vision for surveillance, and in particular surveillance in the underground or in train stations, trying to detect motion, so human motion. That got me really excited about kind of processing visual information. And at the time, my mentor and my supervisor for that thesis wanted us to do a project with the Heathrow Express to count how many people were in the queues of the Heathrow Express using computer vision. And so I was actually gonna do a PhD in that. But then my mentor decided to move to a different university. I wanted to stay in London. And very fortunately, I went to meet a professor at Imperial College, and he said, "Well, have you ever thought about doing computer vision but for surgery? And have you ever heard of surgical robots?" And I was like, "Wow, no, I've never heard of any of this." And yeah, so it was somewhat serendipitous and lucky. But I got to work with the first surgical robot in the UK, with the first Da Vinci in the UK. And so my mentors, my surgical mentor and my technical mentor, were launching like a really exciting program to develop computer vision systems and to develop AI with that robot. And so really that's how it all started, and I've kind of stayed in that space since. Yeah, exactly. And I just remember after that meeting, um, so I looked at a few different PhDs, and at the time it was the big telecoms boom. And so I was offered a PhD in telecoms, and it was very, it was like a big area. Everyone was getting mobile phones. And so it kind of seemed like a good career move to work in that area. But I just remember like the idea of like surgery, robots, AI in surgery and robots. It was like, wow. And obviously the opportunity to work on something where you might impact healthcare, that was really exciting. So I think broadly, we want to make surgery more precise, hopefully even more data driven. I think it's already data driven. The reason why people perform surgery in a particular way is because that's, to our knowledge, that is the best thing you can do in order to cure the patient. But I think now with AI and with the computing systems that we have and with robots, you can potentially collect information in a way that previously just hasn't been possible, because these devices all generate digital data. So I think there's an opportunity to kind of be more data driven than we have been in the past. There's an opportunity to create systems that are different to what we've had in the past. So systems that might be able to navigate or to identify risks or to predict when something may go wrong. So I think those are really some of the opportunities. And of course, if the instrumentation miniaturizes, if we're able to access parts of the body in a less invasive way, then that also has a tremendous impact. So patients can recover quicker. You might be able to treat patients that were previously unable to receive surgery due to comorbidities. So I think there's a lot of opportunities to improve the outcomes for patients in that way. It's complicated and it's long. It's sometimes longer than you may think. So I think developing the initial technology or seeing that first feasibility is really exciting, and that's kind of the research component. But then if you want to scale it, or you want patients to be able to receive the benefits across different hospitals, across different sites, suddenly everything becomes very, very complicated, because you need to be able to support that technology. You need to be able to support the clinical teams to learn and to adapt in using it. It becomes a medical device, so it requires regulation, it requires reliability and testing, and so suddenly there's a lot of things that are much further beyond the original foundational research that you did. And I think one learning that I think we discovered over the maybe it's been obvious to other people, but it wasn't obvious to me, was that really you kind of have to create a company at some point, because then the focus of that company is to make sure that that device is regulated, that it's safe. That company then bears the liability of deploying that device in clinical practice, supporting it, manufacturing it there's so many bits and pieces that need to be done that are very difficult to do unless you have a focused long-term commitment on that particular device or that particular technology becoming available and becoming used and widespread use and so forth. And so, to support some of those trials, that understanding, you really need that focused activity. And from my experience, that can really only happen in a company. Yeah, it could happen, the early phases of it can happen in the academic setting, but it's just more difficult to maintain.
How does the medical legal aspect of that kind of work, do you think?
It's a very difficult question, and we're not quite there yet in terms of answering it. I think from a kind of medical device development perspective, your device would have claims, and you need to present data where you are sure about your claims, and you need to have some sort of a verification that your device is going to function as expected within some parameters, for example, with certain camera systems or certain patient demographics. And so I think that's the kind of the device development route, and you need to do a lot of work to verify and validate and to make sure that the device is safe.